All right, class, I'm gonna show you guys how to put in an IV. So our first step, of course, hand hygiene. Now, I'm gonna get all of my equipment together. So we are going to need a Chuck's pad placed underneath the patient's arm. We are going to need our pair of gloves, tourniquets, what's called a pigtail. We'll use this to screw onto the actual IV. We need our IV needle and catheter, alcohol, a flush, and our Tegaderm. After we have put all of our equipment together, we are now going to assess for where we actually want to poke our patient. So if you remember from the reading, we're actually supposed to start most distal and then work proximal, but for the purposes of this video, we're gonna do the AC. So I'm gonna tie my tourniquet. And then just like during venipuncture, when we feel for a vein, can you please squeeze? We don't need to have our gloves on, but after we clean it, then we need to be wearing gloves. So I like this one right here. I'm feeling the path of the vein as well to make sure that my catheter isn't gonna bend any crazy way. This one is pretty straight, and you can kind of see up here there's a little bit of a bifurcation, so that means we're gonna have valves. So I wanna make sure that I'm not inserting directly into a valve. I'm gonna release my tourniquet, and now I'm gonna set up my supplies. Hand hygiene again. Oh, our Tegaderm, I'm gonna go ahead and open this up, but I'm not gonna let the actual part that's going on the patient, which is under this sticker, touch anything. I'm just gonna fold this piece so it's a nice easy peel for me. I'm gonna set that to the side. I'm gonna open up my flush. As you can see, there's a little air bubble at the top. This is not enough to cause an embolism or anything like that, but I'm gonna go ahead and get rid of it so that I don't have to worry about it. So I'm twisting my syringe and pushing up until the bubble is gone. And then that's actually gonna get screwed to our pigtail. And so I'm taking out my pigtail. You can see these two ends with the ports, with the female end ports, are gonna be what's actually connected to the fluid. This single side is gonna be connected to the patient. So if you look right here, this is what's gonna go into the IV catheter, and this part you wanna keep as sterile as possible. So I'm gonna leave my cap on, but a little bit loose so that I can flush both sides of my pigtail. Proper way to do this, we're gonna clamp one side, and then we're gonna screw in our flush to the opposite side, flush it through until we get a little drip. And then we're going to clamp this side, unclamp the other side, and now we're gonna flush this one. You can see the fluid move through, so our line is clear. We've got no bubbles in there. Now I can go ahead and leave this connected. I'm gonna put it back in here just to keep it as clean as possible. I'm gonna open up my needle. We're using a 20 gauge today. Make sure you check your expiration date. This is not expired. This is what your IV needle and catheter set actually look like. This clear part is the chamber where you're gonna see flash. So I'm gonna take off this cap as if I were ready to stick the patient. The top side is what I'm gonna use to actually push and advance the catheter. And there's a needle underneath of it. So once I get blood in the chamber, I'm gonna advance the catheter through the vein. The needle will safety itself. And then this little flexible straw part is the actual part that's gonna be left inside the vein. And then we have the opening of the catheter. You wanna keep this part sterile, so you shouldn't touch it to anything. And then this is what's gonna get connected to our pigtail, the single end of the pigtail. One last time. We've got all of our equipment set up, and we've got our real deal needle here. So I'm gonna open this up. And then now we are going to apply our tourniquet. Tighten it a little bit. Squeeze for me, squeeze, 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 squeeze. Okay. I know my vein, I'm palpating it. it's there, so I'm gonna go ahead and apply my gloves. Now I'm going to clean it. So if you have a patient where the veins don't show up super well, there's a couple of tips. You can take the alcohol pad, scrub it against the vein. For most patients, this should cause the vein to pop a little bit because we're irritating it. Some places teach you to slap the vein. I don't like doing that. I just like scrubbing it. Once I have scrubbed it, now to make sure we're wiping away any bacteria, we're gonna do our cinnamon roll out of there. Trash, trash. Now we are ready to actually begin. Opening our needle. Making sure our catheter is not stuck down there, so I'm just moving it up a little bit, putting it back down to where our bevel is up. Now I'm holding it in a way that I can actually see the chamber when it fills up with blood. Now I'm starting just below it. I'm going to insert, small pinch. Now I have blood in the chamber, so I'm going to advance my catheter all the way up to the skin. Now I'm gonna hold tight right above my insertion site so that we're not bleeding. Pop our tourniquet, and now we're going to screw in our piggy tail. Now I'm holding onto the catheter while I screw it into there, and we are in. Now, be careful not to let this move around because we don't want it to be causing pain to the patient or anything like that. We've got that nice and settled in, so I'm gonna take my flush. I'm gonna draw back, making sure that I'm still in the vein, so this blood return means that we're good. Now I'm gonna slowly push this. You can let your patient know they might taste a little metallic-y taste or feel a little bit tingly at the site. That's totally okay. Now we're gonna push that all the way through. Now, I'm gonna unscrew this just because when it's dangling, it kind of tugs a little bit at the catheter. Set that to the side. Now we can apply our Tegaderm. If at this point there was blood all over, which is totally normal, we would clean that before we put this on because we want this to look nice. And then so it's gonna go with this little indentation crease over the actual tubing. That's what that's there for, and it gives us a little window. And then we're going to peel this. And then our fluids are normally gonna come from the outside, so I'm gonna loop this around the outside, and then this is where I'd put the date and my initials. I'm gonna stick that on there, and now we have our two little piggies whenever we are ready for infusion. All right, once the provider has said that we are good to remove, we're gonna first put the sharps away. We're gonna be peeling up this Tegaderm and pulling the actual catheter out. So for this, the only things that you'll need is possibly an alcohol pad and a little bit of gauze and then some Coban. If you have a hairy patient, you're giving them a free wax if you just rip this off. So I'm gonna gently remove the corners, scrub a little bit under my Tegaderm while I pull it so that it's less painful. We loosen up that adhesive, and we're gonna do this all the way around. You doing okay? Mm-hmm. Okay, until we get to where the actual catheter is. I'm gonna pull that all up so I don't have any adhesive in my way. Bundle it up, and then I'm going to take my gauze, place it lightly over the catheter, pull it out, 1, 2, 3. Have our patient apply pressure, and then we're making sure that the entire catheter is all the way intact because it was inside the body. And then all this sharps. With the Coban, like we already talked about, you're just gonna wrap this around the patient. Not too tight to where it's cutting off their circulation, but tight enough to apply pressure. Then we're gonna rip it. And then I'm just gonna tuck this underneath so that our patient has easy access to remove this whenever necessary. And that's it. That's your IV.